Hypertrophic cardiomyopathy is a genetic disorder where there is a problem with the muscle fibers of the heart, causing it to thicken in certain areas. There are varying degrees of the disorder, and there are also varying severities and areas where the heart can be affected. Try to remember that hypertrophic cardiomyopathy is a thickening of the heart muscle, and there are other conditions that we treat that can also cause your heart muscle to be thickened and not have hypertrophic cardiomyopathy. Those conditions would be hypertension, diabetes, and other diseases of age that can cause the heart muscle to appear thick without the actual hypertrophic cardiomyopathy disease itself. The most common symptoms that are seen in hypertrophic cardiomyopathy are symptoms that also mimic other diseases. The three most common would be angina, or cardiac pain. The other would be shortness of breath, which can occur with or without exertion. And the third, and probably the most concerning, would be syncope or passing out. The actual symptoms by themselves could mimic a number of other diseases, such as coronary artery disease, congestive heart failure, or some other valvular disorder. The most useful tool that we have to diagnose and to determine the extent of treatment is based on an echocardiogram. This test is a very simple ultrasound of the heart that we do at all of our facilities in Premier, where we can determine exactly the severity and the extent of the disease. The incidence of the disease is 1 in 500 people, and so physicians should always have a high index of suspicion when they're diagnosing somebody with a new murmur or with an episode of syncope, or having a patient presenting with chest pain or shortness of breath where other testing has proved non-diagnostic or inconclusive. Hypertrophic cardiomyopathy is usually treated with medication first. The medications that we would typically start with would be something like a beta blocker or a calcium channel blocker. The larger and more extensive treatment would involve a surgery. Now, this is only in certain patients who have a severe form of the disease called hypertrophic obstructive cardiomyopathy, where the blood cannot exit the heart correctly because of a thickening at the exit of the blood from the heart ventricle. In those cases, a surgery to reduce the amount of thickening would take place in a highly specialized center where this surgery is done quite often and done very effectively. There's also some other catheter-based therapies that can be used that also carry a different set of risks and benefits. Probably the most high-risk patients are patients who have a family history of this condition. In those patients, we recommend that their first-degree relatives all be screened for the condition. Adults who are first-degree relatives of a patient with this condition are usually screened once every 5 years with an echocardiogram. If you are an adolescent starting at that age of 13, 12 years old, we recommend a echocardiogram every 12 to 18 months, or if they are in any consideration to play competitive sports. The condition is usually, if in a certain form, one that would prohibit somebody from playing competitive sports, unless of course they are screened appropriately and were found to not have the condition. Hypertrophic cardiomyopathy carries about a 1% per year risk of sudden cardiac death. However, the prognosis of the condition overall is good, and most patients can have a normal life expectancy. The condition, in certain cases when treated with medications, carries even a better prognosis, or if there are symptoms present, medication can usually help to treat those symptoms. The patients that have the condition also have a small risk of developing some other cardiac condition where the heart either can go into failure because it does not pump properly or function correctly. Although, as I said before, the condition overall carries a good prognosis. There is genetic testing that can be done for this condition as well. Not everybody who has the condition we find a gene for. However, if we do genetic testing and we do find a gene, it makes screening even easier, because then we just have to screen every first degree relative for that particular gene. As I said, the life expectancy of somebody with hypertrophic cardiomyopathy is actually very good, and it's usually normal. With proper treatment, in some cases, if surgery is indicated, these patients can live a normal life.